Today we're going to be talking about facial rejuvenation. One of the most common questions I get from my patients is what's available to help with the cheeks, the jawline, and the neck area. One of the procedures we like to perform here in the office is called the QuickLift. The incisions for the QuickLift are placed in the hairline and the temple area, around the natural curves of the ear, behind the ear where it's well hidden, and back into the natural hairline in the back of the head. These heal up very nicely as thin scars with the hair actually growing through the scar. It gives a very natural result and a very easy recovery time. One of the great things about this procedure is it's less invasive than your standard facelift. Usually most patients can go out within a few days after the surgery with a little bit of makeup on. It also depends on how much bruising they have. The nice thing about it, even early on, the scars are hidden very well, especially if you have a nice thick hairline. Also, the longevity of this procedure compared to a standard facelift is very similar. I tell most patients, but it depends on their skin and their health and other aging factors, but most of these procedures are going to last 5 to 10 years before you might think about doing something else. The other nice thing is you don't get that done look, that fake pulled look, so the patients just look refreshed. The great thing about this too is it can be combined with other procedures. Many times patients like to get everything done at once: their eyes, their cheeks, their jawline, their brow, and also maybe even do a skin procedure as well, so they'll do everything at once. And we'll look at some patients to see what kind of results we get. Our first patient's a 64-year-old lady, very lovely. Just starting to notice some looseness in her neck and along the jawline, and even puffiness in her lower eyelids. So she underwent a quick lift with what we term a submental tuck, which is a neck tightening procedure, as well as a lower eyelid surgery. Our next patient is a 56-year-old lady. After consultation, we decided to do the quick lift, which improved the cheek and jawline area, and she had a little bit of fatty deposit under the chin, and we did some liposuction there. And to correct the puffiness and tired look of her lower eyelids and upper eyelids, we did surgery in these areas. Our next patient is 78 years young. She really looked in the mirror and did not feel like what she saw in the mirror was consistent with the way she feels. After discussion with her, we decided on a quick lift with submental liposuction, a brow lift to freshen her eyes, and upper and lower eyelid surgery to make them brighter and more youthful appearing. And today, you would look at her and never suspect that she's almost 80 years old, and now her appearance matches her bubbly, outgoing personality. Hopefully this information was helpful. And if you're interested in any of these procedures, I'd love to talk to you about them. Thanks for tuning in.